I've been just reflecting on my experience with cannulas, which have been pretty revolutionary in my practice. As many of you know, we now have a cannula training course specifically at SkinViva, and with a few scheduled in the diary, but tomorrow is our first one. So I've been thinking about what happened to me in terms of my journey with cannulas to see if you can kind of understand where they might fit in with your practice. The first thing is I wasn't trained generally by my mentors. Mostly were Allergan trainers, Roger Killer, David Eccleston, various Maurizio De Maio now as well. But they tended to, in years gone by, to be more focused on needles, certainly in their official training. Now I think a lot of those practitioners use cannulas a lot more in their day-to-day practice than they were on the training, and this kind of affected when I got involved with cannulas a little bit. But I tell you what did happen rapidly, which was probably the biggest thing, is that you actually initially find them a bit stressful because you're used to just sticking the needle in, getting the job done, coming out, and all of a sudden there's this extra stage of placement. And I think a lot of people find that a bit stressful because it's kind of fiddly, it's tricky. The longer it takes, the more uncertain you think your client is feeling, and they're like, what's going on, and why isn't this happening, and why they feel messing about. So it can feel a bit stressful at the start, but quite rapidly I found myself finding it really difficult to use needles where I used to do it all the time. And the first place this happened was in the medial fold. So back in the day, that was, we do these kind of cross-hatching, and it's still a foundation skill which I still use occasionally day to day, but I massively moved to using cannulas in that area, and it's for one really key reason, which is, as most of you will know, when you do put a needle in here, there are big kind of facial veins that run down. You often see them running underneath your neck here, so you can spot them before you inject. But you're crossing an area where there's a vein, basically, and huge hematomas are quite possible. And actually, certainly in my early days, I remember getting quite a few big ones. I think I was a little bit deeper than I inject now, or a little bit too superficial, depending on whether you're volumizing or treating a crease. But those big hematomas are very unpleasant, and I knew you'd always know straight away when you've caused them. You'd inject, you'd see that, you turn around, you're changing your needle or something, and you come back and there's a little ballooned area, and it's I really do not like that feeling at all. So what happened with cannulas, I rapidly realized two things. One is very good for actually the lowest part of the medial fold, creating a straight jawline. Cannulas are amazing at that because you can line them up exactly on where you want to create and strengthen the area, and you can fill that. But the second thing is there's just way less chance of bruising. So what I find myself doing is gravitating to more and more, almost like on an emotional level, like I don't want to put a needle in because I know that like 1 in 10 times I'm getting pulling out and there's a gush of blood. Whereas with a cannula, once you've got that initial pilot hole, you don't get that at all. And so you start to naturally do it less and less until it actually starts to feel a bit wrong putting a needle into areas where you've been using a cannula for a long time, because it just works so much better. It's less bruising, you get the result you want. The other thing that happens over time is you become a bit quicker, because you can, through one hole, you can sometimes place an entire mill. Now, if you think how many individual injection points you have to use to place a full mill of filler, sometimes you might be going in 10, even 20 times with that needle. So the bruising's through the roof. It's much more traumatic. There's more blood involved. There's more waiting in between injections as you hold the bleeder. So it can weirdly become actually very quick. And if you ever see these, people on stage, I know Maurizio De Maio will do a presentation and inject kind of 15, 18 syringes in a session. And certainly when I'm doing big treatments like that, I couldn't do it with a needle. You just can't. Like it would be horrific for the patient. You'd have tons of bruising. It would actually take you a lot longer unless you've got an assistant there to hold each bruising area. You're just stopping all the time to hold areas to try and reduce bruising. So this is quite an emotional twist that you suddenly think, God, like do I have to use a needle? It starts to feel like, oh, that is the best thing to do there, so I'll use it. But you become reluctant using a needle. So it's been quite a big shift for me. The other thing that gets onto your mind is complications. Now, I'm pretty sure the complication rate from blocking a blood vessel with a cannula will be 1% of what it is with a needle. That's what I instinctively feel. It's incredibly different injecting with a needle compared to the cannula in terms of your risk of getting into a blood vessel. So once you start to really weigh up the chance of complications, plus the fact that you get less hematomas, you just gravitate more and more towards them. So I'd be interested to hear other people's experiences. For me, it was a game changer, but it happened in a period of about 4 weeks. So you do your training, you try it, it's a bit fiddly, you don't really enjoy it, then you have a couple of successes, and then all of a sudden you find yourself unable to pick up a needle for those areas anymore because it just feels so much cleaner, quicker, easier, less painful. It's not entirely without pain, obviously, because you're still putting a needle in, but the word people use most often is it's weird. It feels weird under the skin, but I think I'd rather have weird than pain. So yeah, I'm interested in hearing your thoughts. Tell me what you think about using cannulas. What's your been experience so far? Have you had the same experience of suddenly like going from one extreme to the other, using needles, to suddenly I'm only going to use cannulas? There are some places where we bounced back the other way. So tear trough is one of those. We went straight to mainly using cannula because of the less bruising, but then discovered that because it's slightly less deep, there are times when you need to go deeper, and a needle is the best way to do that. So I'm not entirely only using cannulas, but it's probably become 70% of my dermal filler treatments. So yeah, I'm interested to know how everyone else got started on it, because I don't think a lot of manufacturers train. So if they're making a big impact on how other people train in the industry, so they tend to use more needles, that can change your perception of how often to use a cannula. But if you've made the shift, if you've done training, or if you're thinking about doing training, what are your thoughts? What do you think what difference do you think it will make to your practice? What difference has it made to your practice? And what's your philosophy now? What do you say to patients? It'd be really interesting to know. So tell me your views on cannula. It'd be nice to hear. And yeah, that's just my thought for the day. So the final thing I was going to say is that if anyone else came across that case, it was quite well known by my colleagues, there was a case on the ACE network of someone who had a blocked blood vessel, probably part of the infraorbital artery, with a deep injection. It was supposed to be deep, we don't really know for sure because none of us were there. It's supposed to be a deep injection onto the nasolabial fold. Usually that's at the periosteum level. The artery is meant to be more superficial, but clearly filler got into there, blocked some of the internal blood vessels, and there was necrosis in the nose and the palate, so quite a horrible injury. But that got me thinking once again about, could you have done the same job with a cannula, and would you have got the same result or a very similar result and not have had that risk? Because I'm pretty sure a gentle technique with a cannula, you can get fairly deep, you shouldn't penetrate a blood vessel. Maybe that's a better way to do it. So I'm just thinking that way. We still teach that. I still see needles as a bit like what print writing is to cursive writing. You kind of need to start with the basics. You need to have it as a skill set, but how quickly should you be moving on to using cannulas in more areas? I think probably quite quickly, because I think it's safer. I think you probably, once you've got the knack of it, you'll enjoy it more. So yeah, those are my thoughts on cannulas. Interested to hear your comments. What do you think? And please let me know. I love reading the comments, so it really helps me to kind of hone the content that I'm producing. So ask questions, share your ideas. You may completely disagree with me. That's always fun. So yeah, let me know in the comments. Tag anyone else who you think might be interested in this or who would like to contribute to it, and I'd love to hear more. Thanks a lot.